Hello, everyone. I'm pleased to announce Dr. Toby Schonfeld, who serves as the Executive Director of the National Center for Ethics in Healthcare. She served in this role for 1 year, and previous to that, she served as the Deputy Director, and then she served as the Acting Executive Director from 2016 to 2018. Welcome, Toby.
Thank you. Happy to be here.
April 16th is National Healthcare Decisions Day. Would you talk a little bit about this day, what it is, and what VHA is doing to ensure that veterans are informed about the decisions they make about end-of-life care?
Absolutely. So National Healthcare Decisions Day is not a VA-specific activity. It's actually endorsed by a number of national organizations. The idea is to ensure that individuals are having conversations with their loved ones and with their healthcare providers about their preferences for healthcare if they are unable to make their own healthcare decisions. So we are working with a number of groups at VA, in particular the group that does advanced care planning group visits, which is the opportunity to bring veterans together in groups to educate them about making advance directives or expressing their wishes in advance of them being unable to do so. So in partnership with them, one of the things that we have done is we've created a set of 4 vignettes directed at veterans. They're super cute animations that my team has been very creative and innovative in producing to give veterans at different ages and different stages information about why they might want to talk to their healthcare providers and loved ones about their choices and what those choices might be.
If you were to give veterans the top 3 things that they should be taking care of when it comes to advanced care planning, what would those top 3 things be?
So the first thing I'd want to say is make sure that all veterans, regardless of age, stage, or health situation, have thought about what they want for choices. The second thing I would say is that the phrase I like to use is proxy is better than paper, which means that it is important to have a written advance directive if you have very specific ideas about the kinds of things you would and would not want. However, we're pretty bad at anticipating what's going to come in the future. And so what a better situation is for you to talk to a person. That person will become your proxy decision maker or your surrogate decision maker, sometimes we say, when you are not able to make the decisions. So you need to have identified the person whom you want to make that decision or those decisions for you. And related to that, you have to have talked to that person. And it's not enough just to say, Dr. Scavella, will you please serve as my proxy? Because if you have no idea what my priorities, what my goals, what my values are, you won't be able to make a decision consistent with those values and goals. So it's really important to talk to your proxy as well. The third thing I would say is that it's really important to revisit your choices, both your choice of individuals who make these decisions and the decisions themselves.
Those are all really, really great suggestions and rules for folks to follow up on. Speaking about yourself, Dr. Schonfeld, what would you say you are most excited about or proud of related to your work in the National Center for Ethics?
So since I got here a year ago, I essentially parachuted in right in the middle of the pandemic surge, right? COVID had just started to attack the country in earnest, and we at VA were trying to do the best we could for veterans while information was changing in real time. And one of the things that I'm most proud of is how my team at the National Center for Ethics in Healthcare have been able to be responsive to the needs of veterans, to the needs of healthcare providers, all throughout this pandemic as the information has changed.
I have one final question for you, and this is a little bit different from the questions I've asked before. It's really about you personally.
Okay.
As you know, March was Women's History Month. As a woman leader yourself, do you have advice that you can offer to women who are either embarking on or continuing their careers?
we often are either stereotyped or characterized as having softer skills or different skills than do our male counterparts. And often that is used against us, right? That women can't be strong or can't rise to the challenge. What I would recommend that women consider is the fact that these softer skills are actually necessary in order to be a strong leader. Leadership is all about developing and maintaining relationships. And so it's really a skill to be able to take that capacity and use that to our advantage rather than see it as a limitation. And so I'd encourage women to embrace that aspect of themselves as well.
That's very good advice. I appreciate the fact that you are one of the strong women leaders in VHA, and I'm glad that you're part of our team. Thank you, Dr. Schoenfeld.
Thank you.